Welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hello, my name is Farideh Golembieski, and I am a board certified family nurse practitioner at RevitalyzeMD.
So we have done a Peyronie's overview and really a Peyronie's series just because the specific treatments we wanted to address in particular with studies. And so that's what we're going to do today, Peyronie's and PRP. But before we get into it, please hit the subscribe button if you are not subscribed. If you like what we're putting out, it very much helps the channel. So let's get into it. Peyronie's, what is it?
So, Peyronie's is the development of fibrous scar tissue inside the penis, usually due to trauma, which then can lead to penile fracture.
Correct. And so we have done an overview, so we won't get into that much more, but it is fibrous tissue, starts off inflammatory, then it's fibrous, causes a curvature. So the curvature is one of the things that you can find. Peyronie's is the name for that curvature when it's actually progressed to the point where it's visible for you. And then you can also have not only that curvature when you have that inflammation and scar tissue, but you can have pain with erections and you can have erectile dysfunction when it progresses, which it
So,
does.
treatments are meant to help prevent or slow progression.
Correct. And so the treatments are aimed usually at the acute or the non-acute phase. So acutely, you have inflammation in the area of trauma, which causes curvature in the direction of that scar tissue where the trauma is. And so inflammation acutely, vacuum erection devices being about the only thing really you can do if you're starting to notice that. But honestly, guys probably aren't picking up on that early enough. But at home, you can do vacuum erection devices with the acute phase that work. And then obviously, you can potentially do acoustic shockwave PRP. But most of the treatments are geared towards the more chronic phase. And so that's where you're talking about FDA approved treatments of Xiaflex, which may or may not really be readily available to patients, but we just don't see a lot of patients going for any kind of injectable treatment for
And then
Peyronie's
there are
disease.
some off-label medications, which we also don't really see, such as verapamil. But as Dr. Durst said, we've done a Peyronie series. So we have a great overview video that breaks down all these treatments, surgical, non-surgical, FDA approved, non-FDA approved, adjunct therapies, all of it broken down
Yes.
very well. And then we've gone through and are doing very specific videos on these treatments. So definitely, if you're interested, check out those. And this one we will focus on platelet-rich plasma.
So, what is platelet rich plasma? So, this is one of our favorite treatments. And again, we're not seeing patients that are looking for traditional options that include medications and surgery. So, this is what would be on the FDA guidelines, or sorry, the American Urologic Guidelines of 2015. So, they're outdated guidelines, or at least those were the last updated officially that we could find. There was a minor, update in 2022, but not across the board. But this is an emerging therapy with that, and so it's probably time to relook at that because there's lots of data to support acoustic shockwave and then PRP. There's lots of use of PRP now, and this is just one of those. We do it in practice where we combine acoustic shockwave and PRP with great results. But again, that's a non-FDA approved emerging treatment, but that's the area of medicine that we're in, closing that gap where we're offering those non-traditional options that patients are actually looking for. So PRP, what is it? I mean, what is PRP? We hear a lot about it.
And
So, platelet rich plasma, drawing your blood, spinning it down, getting platelets, and then using the growth factors and all the growth factors in platelets to regenerate tissue. And if you think about like your arm getting cut, you have a cut on your arm. You have platelets that go to the cut, they stop the bleeding, but then they release all the growth factors that communicate with stem cells in the area of the cut. And so you're regrowing skin, not regrowing, scalp or vaginal tissue. So it's communicating with the stem cells that are specifically in that area
to
for
that area.
regeneration of tissue in that area. So it's a great, like, again, you're using the power of growth factors in your blood to regenerate tissue. So this is a treatment that we love PRP. We use it for all the things.
For
And so
safety, think about it. There's not much more safety in using your own blood product.
There are lots and lots of studies. Like if you do like a Google Scholar, Medline search, there are thousands and thousands of articles that will pop up on PRP and no reported adverse effects. With that, of course, significant. You can, whenever you put a needle on something, you have bleeding and bruising and swelling. And so that is the case. And then there's
But
some
we're also
outlier.
wanting to cause inflammation.
Yes,
It's an
no,
inflammatory process that we're trying to start. So,
correct.
inflammation isn't a bad thing. So, you don't want to knock out that inflammation and take Advil or ibuprofen or any of
Correct.
those medications to prevent inflammation.
And in fact, you don't want to take those leading up to the procedure as well because it can interfere with those platelets for a long period of time. So, the bottom line is you have such power of regeneration in just your blood tissue with PRP and platelets. And so, we use it for aesthetics, sexual wellness, and all kinds of different procedures. We love it, but this is sexual wellness and men's health in particular, in Peyronie's disease, if we're talking about which condition. And so we're taking it, processing the PRP, and then re-injecting it into not only the penis for increased blood flow and erection strength, but into the scar tissue.
So, we can
So,
focus on that fibrous scar tissue to help break down that tissue to help prevent that curvature from growing and expanding and maybe even give some relief.
yeah, so you're basically helping that collagen remodel to align the right way and provide the tensile strength it's supposed to. And so combining that with acoustic shockwave is great because it's communicating that injury pattern to the tissue to repair, so to realign and formation of new collagen so that it is now realigned the right way to provide strength again. And PRP is just another way of communicating that injury pattern to tissue, injecting platelets in to a tissue. The tissue thinks it's injured because that's what typically happens. The platelets release the growth factors and the tissue is responding with regeneration. So,
And as Dr. Durst mentioned, there are studies to support this. There aren't a ton of studies, and they tend to be a smaller sample size, but they are out there. There was a study in 2019 showing a reduction of up to 30% in curvature with PRP. That's a huge reduction for something that's natural to the body that you can come in. These are alternative treatments, as she pointed out. But the patients we see, they're not being given medication options, or they have been told, oh, you need surgery. And they're like, I don't want to do surgery. That scares me. Anytime you can prevent cutting, we should prevent cutting. So this is a great alternative to surgery. It's a non-surgical option. And we do see, like I said, in the studies, a reduction of curvature of about 30% from baseline measurement.
and
That's
that was a
big.
2019 study of PRP with Peyronie's disease. And the big thing is that the FDA approved treatment was 32 to 34% with potential side effects, and that was Xiaflex. And this is with no reported, no potential safety issues whatsoever, and about the same. And as far as results, with added functional benefits, I might add. So,
Absolutely. There was a 2020 study also showing a reduction in the fibrous tissue, tissue healing, and then reversal of plaque formation and reduction of pain. So there are studies looking at the side effects of Peyronie's and seeing those symptoms resolve with treatment.
and PRP with shockwave combination in 2015 that showed, again, a 40% reduction in curvature, but also functional improvement because we're also injecting. So that acoustic shockwave is communication to the tissue in general, the penis, and not just the scar tissue, and the PRP is the same. So not only are you getting remodeling, stimulation of collagen, elastin in that area, remodeling of collagen, but you're also getting improved blood flow, harder erections, better sensitivity. So you have a functional improvement, no side effects, and studies either equivalent to or more than effective than the FDA approved treatment from a 2015 guideline. So lots
I
of
think
study support.
Yeah, I think it's important to note that in our clinic, we do treat a little bit holistically, right? You heard us say that. We approach from multiple angles. So we use a combination of PRP, the shockwave therapy, and then we also use erection vacuum erection devices as well. And we've talked about those on other podcasts, but we are multifocal in trying to prevent and repair tissue.
And so, and I love like the holistic term. I wish that some people didn't think of that as like a non-medical based, because it's correct that we are holistic. We almost use comprehensive and kind of gap medicine or non-traditional options just because we are approaching it from a holistic, a complete standpoint. So comprehensively without medicines, if at all possible, and without surgery. So regenerating, giving the tissue back what it needs, but doing that from multiple different approaches.
You're right. I never really
And
thought
so,
about that. Holistic is kind of viewed as a non-medicine, where
yeah,
comprehensive
like
is
an,
viewed as medical, but they are really kind of the same thing. We
it's kind of the
holistically,
same.
comprehensively treat.
Yeah, I frequently want to use holistic in a lot of the content that we have on the website, but I have not done so because I don't want people to think it's a naturopath or a holistic, non-medical based officer
Treatment.
provider. So that's not the case. So we provide medical treatments but it's non-surgical solutions that patients might be looking for, and that's a gap in medicine that doesn't exist. So there's traditional medicine, and then there's a completely non-medical but holistic, supplements, like there's lots of different approaches. We're kind of in
More
the middle.
regenerative
Yeah. We
focused.
we want to offer what has basis scientifically but isn't used in traditional offerings potentially. Maybe it is. Sometimes it is. We wish it was always,
Exactly.
but
You
because there's
mentioned gap
science.
medicine, and when
Yeah.
we look at the Urological Association guidelines, we see that gap pretty clearly. The
Yeah.
guidelines are from 2015. We're going on 10 years out from those guidelines.
Yeah.
And acoustic shockwave and PRP are mentioned, but they're just mentioned. They're
Yeah.
not really supportive at this point yet.
Yeah. So really it is that gap is things that are being looked at. There aren't issues, there's results and studies that support it, but just aren't being offered in lots of different places. So that's us. So again, we do remote consults, at least planning consults where we can talk to people or they can get information that they might not be able to get, maybe help guide, even if it's local or if it is eventually in our office, just so you know. So anyhow, let us know your experience. Do you have Peyronie's disease? What have you sought as treatment? Has anyone done P shots? Has anyone done PRP for Peyronie's disease? We would love to hear about it. And anything else you want to hear on a podcast, because we're willing to deep dive into anything sexual wellness or wellness.